Okay, so we're going to do a quick palpation review of the wrist and hand for you. So, all right, so you should know by now where, if we look at the radial side of the hand here, where the radial styloid is, right? Obviously, just palpate down the radius. The most distal point of that radial styloid, the most distal point of that radius is the radial styloid. Now, that's important because just proximal to that, if we ulnarly deviate the wrist, is where our anatomical snuff box is, and at the base of that is the scaphoid. Very important bone to be able to palpate if we suspect a fracture or something like that, right? Just distal to the scaphoid is your trapezium. Now, if you want to know if you're on your trapezium, right, you can just oppose and extend the first digit, the metacarpal. If you move the metacarpal, you can clearly feel the joint line just distal to the trapezium. All right, so if you're on the joint line, obviously, you're on the thumb CMC. If you're just proximal to it, you're on the trapezium. It is hard to feel the junction between the scaphoid and the trapezium. Okay. Now, if we move to the back of the hand, if we remember, there is a landmark called Lister's tubercle. All right, now Lister's tubercle, remember, is just in between that second and third met, right? And just approximately in between that scapholunate interval, all right? So if we find Lister's tubercle, right, and if we know we're in the right place, if we look down at the hand, right, and we can see that we are basically in between the second and third met, all right? All right, so just right there, and that's pretty much in between the second and third met. Now, if we go just distal and a little bit ulnarly, in line with that third met, we're going to find just distal to, you can feel that better in a bit of wrist flexion. It'll pop into your finger. If you extend the wrist, it'll sink down. If you flex the wrist, it'll pop into your finger. Just distal to that is going to be capitate. If you want to know if you're on capitate, if you flex and extend the wrist, capitate's not going to disappear from under your finger. Right? Capitate's dead in line with that third metacarpal. Right? So if we look at now the ulnar side of the wrist here, right? So here we have our ulnar styloid process. And if we go just distal to the ulnar styloid process, now deep in here, all right, all along this area here, that is where that TFCC is located. Now, we obviously can't directly palpate our TFCC, but if someone has a torn PFCC, we can push around in this area and generally it may be tender. Right? Now, if we look at the palmar aspect of the hand, all right, we can come around and we can find the pisiform pretty easily. All right? Now, once we find the pisiform, if we go just distal and a little bit radial and push in a little bit into the hypothenar eminence, we can find a little bony pinpoint. That is our hook of hamate. All right? And our hook, in between our hook of hamate and pisiform is where Guillaume's canal is, and that is where the ulnar nerve comes in and runs underneath the hook of hamate, and then it provides innervation to the rest of the hand. Right? Another important landmark to know is our wrist crease over here. Proximal wrist crease, all right? So that is also called the distal wrist crease, right? Or the wrist crease is fine, right? Just distal to the wrist crease, right, is where the transverse carpal ligament of the flexor retinaculum starts. Okay, so if we were going to do a Tinel's or we were going to do some kind of median nerve compression test of the carpal tunnel, we want to make sure we are just distal to that wrist crease. Okay, right. So that's a quick little review of palpation of some of the various landmarks of the hand.